Well, let's head to Manchester, where we'll find Andrew Gwynne, the Shadow Minister for Public Health. Mr Gwynne, lovely to see you this morning, and we will talk, of course, about your brief specifically in just a second. But in terms of those strikes on the railways, discussions with the RMT appear to have broken down. 4 days of strikes are now looming. Where do we go from here?
Well, I think it's incumbent on the Transport Secretary to sit down and negotiate a deal. The fact that the Transport Secretary, a bit like the Health Secretary, has refused to do that is what has led to this situation over Christmas. And ultimately, the public will now be worried about whether their Christmas arrangements are in turmoil. The government's really got to get a grip of this, and that starts by sitting down, negotiating, and coming up with some kind of compromise that both sides can live with.
But in terms of the matter rather closer to your brief, nurses and the prospect of them going on strike, I mean, are the pay rises that they are asking for affordable?
Well, look, I've not seen the books beyond what's in the public domain. They probably aren't. But again, it's that refusal of the government to speak to the health unions, and this has been going on since the summer. That refusal to negotiate has caused this problem. There were no strikes in the NHS during the 13 years of the previous Labour government. And that's because we had good working relationships, not just with the unions, but with the workforce across the NHS. I still think it's possible to avert strikes in the NHS if the Health Secretary will sit down, negotiate with nurses, because, look, patients already can't be treated on time, and strike action is the last thing we need. Yet the government's letting this happen, and I don't think patients will ever forgive the Conservatives for this dereliction of duty.
Sure, but to be absolutely clear, just like the Conservatives, you're not promising inflation-busting pay rises.
Well, we're not saying that we can afford what the unions are asking for, but a negotiation is just that. You sit down, you listen to the issues, you listen to the concerns on both sides, you come up with common areas to agree, and ultimately you come out with a deal. The government's not doing that. We would do that. We would sit down with the employers' representatives, and we would ensure that we averted these strikes. As I say, we didn't have a single strike in the NHS under the last Labour government. There's no reason why there should be one under this Conservative government.
But part of the problem that strikes me as regards the situation with nurses and indeed with the RMT is the original offers that were made were based on data collected quite some time ago. The offer was made at a point where inflation was running in the low single digits rather than where it is at the moment. I just wonder whether or not Labour would be minded to push forward with some review of this independent pay body to make it a little bit more contemporaneous with the economic circumstances that we're in at the moment. You would that nurses would have had a far more significant pay offer from the government if that were the case.
Well, look, Labour will always defend the rights of working people, and that includes the right to organise and the right to withdraw your labour, and these are fundamental rights. But ultimately, the situation that you set out, Neil, is precisely the kind of thing that you sit round the table and you discuss and you come to some kind of agreement on both sides. That may well be something that needs to be put on the table and that Steve Barclay, as the Health Secretary, should take serious consideration of, because ultimately we need to avert these strikes in the NHS, because ensuring as many patients as possible can receive the care that they need must be a priority this winter, given that so many operations are being cancelled in the NHS right now.
Just a word then from you, Mr Gwynne, about the use of military personnel during an ambulance workers' strike. The story in the front of the newspapers this morning that taxi drivers could be drafted in to get people to hospital.
Look, that's a sign of failure, and I hope the government can avert all of this. All they need to do is to sit down round the table with the representatives of the trade unions, come up with some compromise agreement, and let's get our NHS working again.
When you say get the NHS working again, there does appear to have been a fairly significant change in tone from the Labour Party as regards the NHS. I mean, Wes Streeting saying just the other day that the health services is not a shrine. I mean, do you agree with that? And if so, can you explain exactly what he means?
Well, look, I think what Wes means is that the NHS was founded in 1948. Its guiding principles are as relevant today as they were back then. But it's not some monolith that doesn't change, that's set in aspect. It changes throughout the needs of history. So, you know, the NHS of 1948 was very different in 1968, very different in 1998, and will be different in the future. That will come with investment from the Labour government. We are committed to a workforce plan. We are committed to getting those waiting times and waiting lists down, and we are committed to new technology.
Sure.
That reform...
You're not comparing Wes Streeting to Nye Bevan, are you?
Absolutely. I think that Wes Streeting will be the modern Nye Bevan under the next Labour government, changing the NHS, making it modern, making it relevant for the future, but important, getting better outcomes for patients, new treatments, new technologies, and better outcomes. That's what has to happen. And with every penny of investment, we have to make sure there's a return for that. We have to make sure that the productivity is there. We have to make sure that those waiting times and waiting lists come down. It's only, Neil, what we did in the previous Labour government. We got the NHS back on its feet after the previous Conservative government had shattered it. We want to do that again. We want to make the NHS fit for purpose, fit for the 21st century.